Sugar sweetened beverages take a toll on health of Kano's populace as tax implementation stalls in Nigeria. Thabita Yanga, 40, a food vendor in Kura town of Kura Local Government Area in Kano State, loves to indulge in the consumption of sweet treats like cakes, an array of assorted soft drinks. She thought that as long as she exercised regularly and maintained a healthy weight, she was okay. However, Thabita didn't realize that her sugar consumption of sugar sweetened beverages SSBs was affecting her health in many ways.
Ni farko ne ina ji kafana yana min zafi to sai na rasa me yake damuna har na dauka ko gini gida da nayi sabo shine aka yi min wani asiri ne ina ta sha magani gargajiya.
Thabita's SSB consumption was leading to weight gain, which in turn increased her risk of several health issues such as heart disease, diabetes, and cancer, in addition to inflammation, which can exacerbate her conditions. As Thabita continued to consume large amounts of sugar on a regular basis, she began to notice her energy levels were lower than usual. She found it hard to concentrate and often felt sluggish throughout the day. She also noticed that her skin was looking dull and was breaking out more often than usual. Eventually, Thabita, after seeing a doctor, realized that her SSB consumption was the root cause of all these health issues, and she decided to make some changes to her diet by reducing her sugar intake and replacing sugary treats with healthier alternatives like fresh fruits and nuts, as advised by her doctor.
Kowane lokaci na je asibiti zan kashe 5,000-6,000 kudin magani kawai banda transport da zan je Aminu Kano in dawo.
However, as she made changes to her diet, she started to feel more energetic, focused, and her skin began to look healthier too. But Thabita is just one out of many of her type that is affected by consumption of SSB, some without even knowing. For the likes of Yahaya, who consume 8 to 10 bottles of soft drinks, food is immaterial. Yahaya, who admitted to witnessing various health challenges, including constipation, did not realize that his consumption of SSB was a contributing factor. Hence, he vowed that even if a tax was imposed on such drinks and it amounts to 1,500 naira, he will still consume it, but may reduce the quantity he takes per day. It is no different from Naziru Raji, 24, a local singer who also deals in the town's mainstay rice selling. But for 34-year-old Aminu Dallami Abubakar, who is a regular consumer of soft drinks and energy drinks worth more than 5,000 daily, his consumption of these items has reduced, which he attributed to health concerns.
Another
rice seller, 29-year-old Ismail, who consumed soft drinks during the day and 2 at night, says he was always sick, but after he got medical advice to reduce intake, his health began to improve. There are several countries around the world who have implemented taxes on sugar sweetened beverages to reduce its consumption and combat obesity and related health problems. In 2014, Mexico introduced a tax on SSBs of 1 peso per liter, about 10%. This tax was expanded in 2020 to cover the other sugary drinks, such as sport drinks and flavored waters. Similarly, in 2018, the UK implemented a sugar tax on soft drinks with a tax of 18p per liter on soft drinks containing 5 to 8 grams of sugar per 100 ml and a higher tax of 24p per liter on drinks containing more than 8 grams of sugar per 100 ml. Other countries that have implemented tax on SSBs include Hungary, Portugal, Chile, and the city of Philadelphia in the United States. Many experts have advised Nigeria to go along the same route to curb the challenges associated with indiscriminate consumption of SSBs. which is in turn stretching Nigeria's health facilities. 24-year-old Hajara Ibrahim, a dental surgery technician at the Kura Primary Health Care Facility, expressed concerns about the high number of cases the facility contends with. According to her, refined carbohydrates and other soft drinks, especially taken at night without brushing before going to bed, have brought about serious dental concerns.
Yawan shan zaki shi ma yana taka muhimmiyar rawa sosai wajen kawo matsalolin haƙori.
Dr. Kabir Sadabello, an endocrinologist who handles diabetes and thyroid cases, says the best drink is water, as 70% of human body is composed of water. He says again, consumption of SSBs increase the risk of non-communicable diseases, especially diabetes mellitus, which is a common disease in Nigeria. Around 6% of Nigerians have it. He argues that increasing taxes on SSBs can regulate consumption and minimize the risk of diseases.
Generally, diabetes is commoner in urban settings. In Nigeria, it has been found that most studies that were done in urban settings, the prevalence of diabetes is higher compared to rural settings. And this can be explained by lack of exercise in those that live in urban areas, and then those that live in urban areas, they take more food that are not very good compared to our brothers and sisters in rural communities.
Nigeria has yet to impose a tax on sugar sweetened beverages, SSBs. However, there have been discussions and proposals to introduce such a tax in Nigeria as a means to reduce the consumption of sugary drinks and promote healthier lifestyle. In fact, in 2018, the Federal Ministry of Health in Nigeria announced plans to introduce a tax on SSBs, but the implementation has been delayed. It's worth noting that some Nigerian states such as Lagos and Ogun have already implemented a tax on SSBs, but it has not been enacted nationwide. There are several advantages to imposing a tax on sugar sweetened beverages SSBs, ranging from health benefits, revenue generation, and other economic benefits. But overall, a tax on SSBs can be an effective policy tool for reducing sugar consumption and improving public health outcomes and promoting healthier choices. In terms of out-of-pocket expenses, in countries where SSBs are more expensive, people may be less likely to consume them, as they may choose less expensive alternatives or drink less overall. A study published in the American Journal Preventive Medicine in 2019 found that higher out-of-pocket expenses for health care were associated with lower consumption of SSBs among adults in the United States. The study suggested that this relationship may be due to the fact that people who have high out-of-pocket expenses for health care may be more aware of the high risks associated with consuming SSBs and may be more motivated to make healthier choices. Notwithstanding, the story of Thabita and others like her shows how excessive sugar consumption can have a negative impact on people's health. Hence, being mindful of SSB intake and making healthy choices can maintain physical and mental well-being. Khadija Ishaq Bowers.